A few self-assessments that you can do to test for knee pain. The first one is specifically for the quad tendon, testing for weakness. So what we're going to do is called a quad set. So I have a little towel roll rolled up underneath my knee, and I'm going to activate my quads, which are the muscles in the front of my thigh. So what I'm going to do is I'm just going to tighten them and squeeze, and I'm pushing the back of my knee down into the towel roll here. And what you can see when I do that is my kneecap actually moves. So as I extend, my kneecap moves back, and as I relax, my kneecap moves down. If you can't get that quad set, that indicates that you have weakness in those muscles in your quadriceps. Over time, that weakness is going to affect the tendon, and the tendon's going to try to overwork to compensate, and that can put you at a risk for either tendonitis, or over time, more and more trauma, more and more overworking, it can put you at risk for a quad tendon tear. The second self-assessment for knee pain is a single leg squat, and that can tell us a lot of things about muscle imbalances, muscle weakness, poor balance, and affecting the whole chain from your hip to your knee all the way down to your ankle. So what I'm going to do is I'm going to get my balance on one foot. If you need for extra balance, you can hold on to a table, a chair, the wall, whatever you've got next to, and then gently sit back into a squat and then come back up. So what I'm looking for here is good alignment of my hip, my knee, and my ankle. When I come down into the squat, if my knee has a tendency to collapse in, you can see my foot is collapsing in, that indicates that I have a lot of weakness in my hips. And what that's going to do is, if I'm an athlete, I'm running, I'm jumping, if I go to jump and I start off with my knees like this, and I land the same way, that's going to put a lot of torque on my knee, and my knee is going to give a little bit too much rotational component, and that is going to put a lot of stress on the ACL, and that's going to put you at risk for an ACL tear. If you are positive for either of these two assessments, be sure to give us a call at our office. Our phone number is 703-450-4300, and we'll get you scheduled right away for an evaluation.